keeping London healthy. My name is Dr. Mario Elia. We've got an exciting episode for you today. We're doing an interview with an infectious disease physician, Dr. Zain Chagla from St. Joseph's Hospital in Hamilton. And we're also going to take you on a tour of one of the new vaccination sites here in London, the North London Optimist Community Centre, to show you a little bit of what to expect when you're at some of the vaccination centres. So without further ado, we'll get right into our conversation with Dr. Chagla. So I'm happy to invite and welcome our first guest and only guest from today. I'm actually really excited to bring him in. It's Dr. Zain Chagla. He's an infectious disease physician at St. Joe's Hospital in Hamilton and associate professor at McMaster University. So thanks, Dr. Chagla, for taking the time to join us today.
Oh, thanks for having me.
So a little background for our viewers. So Dr. Chagla and I go way back. We actually went to elementary school and high school together. And little did we know 3 decades later, we'd be on television talking about a global pandemic, yet here we are. And the reason I'm really excited to bring Dr. Chagla in is, I know that certainly I do some stuff on local radio and kind of trying to bring some medical perspective to the community. But the question is often, who do I ask when I have questions? And the answer to that is people like Dr. Chagla, who are in the trenches dealing with COVID, treating patients with COVID, and really advising on a fairly high level. So we're excited to bring him in today. I guess I'll start with the first question. So we're well into our third wave here, and unfortunately, our third set of lockdown, shutdown, whatever description the government is using today. So Dr. Chagla, I'll make you premier for a day. What are you changing today in terms of strategy that's not being done?
Yeah, I mean, I think the big thing here is that we have vaccines. So there's an end to this with a permanent solution, but there is a need to get as many people vaccinated to get to that point. So, this cycle of opening and closing in the context of a population that isn't vaccinated fully yet or doesn't have access to a vaccine yet is going to lead us into cycles where we open, things are going to get worse, we close, things are going to get better, and realizing that's not healthy for anyone. It's not healthy for society. It's not healthy for businesses. It's not healthy for people in general. And so, taking the British approach where we use the time to lock down, we get people's contacts low, we try to minimize disease in the community, and we use that as a time to go as crazy as we can with vaccinations, and then opening up slowly. Opening up like we did in March 2020, April 2020, when we went to a little bit of outdoor stuff, a little bit more indoor stuff, and then starting to push into the higher risk settings at that point, once we have more objectives done for vaccine. I wish there was a better way than us closing now. I wish we would have had vaccine supply to mitigate this wave, but realizing we need more time to get there, I would really, if I was in his position, use this as a strict lockdown to just buy us time to vaccinate as much of the population as possible.
You talk about vaccines, and obviously we're seeing vaccination efforts ramping up. You've been pretty vocal about the importance to the public about taking whatever vaccines offered, regardless of what brand it is. Can you tell us a bit more about your reasoning behind that?
Yeah, I mean, I think, when we talk about vaccines, we often talk about herd immunity. We talk about how vaccines protect the population, bring things down, protect everyone else. The reality of the situation, and I don't think people realize enough, is these vaccines on the market actually have very profound effects for personal protection. If I take my vaccine, my risk of COVID-19 goes down. My risk of COVID-19 complications goes down immensely. My risk of dying of COVID-19 goes down immensely. And, I think with more disease showing up in our community, more people being infected, these variants emerging, I would ask, if there's anything as a person you could take to prevent me from ending up in hospital, prevent me from dying of COVID-19 in the next 2, 4, 6 weeks. The answer, based on everything that's come to date over the last 12 months, is vaccination. Vaccinations are the only evidence-based intervention to keep people out of hospital, to keep people from dying. And again, it is something one can take for themselves for a complete selfish reason to prevent them from getting sick from COVID-19. So, all of the vaccinations on the market will do that to an individual. And it's so important with all this disease transmission now that people just take something to prevent them from landing in the hospital and ICU.
Yeah. And cocooning those around who are high risk as well, right? I've heard from some patients, whose parents have gotten vaccinated, that they're still hesitant, and reinforcing with them the importance of, yes, your parent is 95% protected, but if you are also 95% protected, then we start seeing kind of an iron ring around these seniors. How do we get through this third wave as quickly as possible? So what is the public, because a lot of it's been government telling you can do this or you can't do this. Beyond the things we can or can't do, what do you think the public can do, in their daily lives, to try to end this third wave and to keep this success going through the summer if we can?
Yeah, I mean, I think what we're doing now with our restricted measures is trying to make people's networks as small as possible. We know, particularly with the variant from the UK B117, that a single infection can lead to multiple secondary infections, which then can lead to multiple more. And that's why we get this big growth that happened over the last few weeks. The whole point now is, even if COVID is transmitting in the community, we give it so many dead ends for it to get to that it is, all of those chains of transmission extinguish. And so the concept being, if you have the ability in your lives to keep your networks as small as possible, keep them as small as possible. If you're going to have to meet someone, do it outdoors. Don't do it indoors if you can. And let the people that need to work, that are essential for us to keep society going in terms of powering our houses, running our internet, having food in our grocery store, all of those essential needs that we all have, let them be out there and work, and again, afford them the protection by keeping our levels low, and again, vaccinate those individuals aggressively so that they're also protected from all of this. So, going forward, keep networks small, minimize those networks. It gives the contact tracers and public health such a benefit to be able to get transmission under control within our communities.
One of the things that I think, with the public, hearing about numbers of cases and deaths, they get kind of numb to those numbers. But I think, hearing experiences from those on the front lines often does kind of bring a different perspective. Can you tell us a bit about what you're seeing in the hospital in Hamilton right now in terms of COVID?
Yeah, I mean, I think the big thing I've noticed, it's really been for months, is, as much as we thought of the COVID as a disease of, people that didn't follow public health measures, people that, got infected because they partied or went to a restaurant, it's not the reality of what we're seeing on the front lines. We're seeing people that were put in situations where they had no choice, and they were, extremely high risk of acquiring COVID-19, whether that's in their workplace, where they're working really close with individuals, they didn't have the correct personal protective equipment, they were face-to-face with people for a long time. The people that live with those individuals that unfortunately had consequences of having, their partners being infected, their kids being infected, or that type of thing. Or people that were just medically fragile and so supported by people in their communities. And unfortunately, one of those people coming in with COVID-19 and sending it to them. So, again, there are core people out there that are so important for us to run society that are being exposed to risk. It's our job right now to make sure that those are the only people being put at risk, and the rest of us can mitigate the risk, both to ourselves, but to those people in the community, to keep rates low.
What keeps you up at night with, COVID-19? Obviously, we all have our own kind of concerns about it, but what truly worries you about where this could go in the next few months to years in the future?
Yeah, I mean, I think the next probably 2 months, I'm very worried about what happens to our ICUs. And, I think people get really numb to ICU numbers. They're up by 10, they're down by 10. The reality is when someone ends up in the ICU with COVID-19, they either die, which is unfortunate, but the bed is then opened up. But the reality is, if they're saved, which is what we want to do, they're not leaving the ICU very quickly. And again, as we see ICU numbers adding up, those aren't beds that are opening up again. They may be filled for 10 to 20 days. They're not going to turn around. And so as we see more ICU numbers, they're just adding up and up and up. We're expecting 40 to 50 a day across the province. You think in 2 weeks, that's another 500 people in our ICUs. We're at 500 now. That really scares me because we don't have, yes, we may have the beds, but we don't have the healthcare resources, the staffing to provide really good care. And we know mortality for COVID-19 goes up when you can't provide that optimal care for patients. I think that, what scares me in 6 months is when we get people vaccinated and paradoxically trying to get them to actually turn off this fear and get back to normal and realize this is a disease we live with, and how things will change and how we actually inform the public of that. We've been in this state of shell shock for a year and a bit now, and turning it off is going to be a very gradual process, as well as the care gap and the mental health demands that we've created in the last 6 months to a year, where we're going to have to catch up on that. That's going to be a residual part of our society and something that as medical professionals we'll have to deal with.
I think so, Dr. Chagla. We're just going to take a quick break and come back after this message. All right, welcome back. Again, we're being joined today by Dr. Zain Chagla. He's an infectious disease physician at St. Joe's Hospital in Hamilton and an associate professor at McMaster University. So Dr. Chagla, we were talking about ICU beds before the break, and how we've kind of not even really come down from the peak of the last wave because of the people that are obviously still in the ICU. How much do you worry about a fourth wave of ICU spikes driven largely by unvaccinated individuals who didn't think they were a COVID risk and now drive that fourth wave of ICU fillings?
Yeah, I mean, it is a concern, and I wouldn't even say it's just people that didn't think they were a COVID risk. That is something certainly we worry about, but also the people that we just couldn't reach with vaccinations. We're seeing it in actually some places in the United States now, and in particularly Michigan, where you're seeing ICU's cases starting to rise. But you also see a disproportionate number of people who have poor medical literacy, who are from racialized communities, where they're the ones ending up on ventilators. They're the ones who end up dying, as compared to outer communities which did relatively well with their vaccine rates. So obviously it's a concern moving forward. I think all of us have a duty to reach out to our friends, families, coworkers, dispel misinformation, give people the resources on how to sign up and where to sign up. Absolutely, we're going to see transmission, and people, unfortunately, that this became a vaccine preventable disease, which we really don't want to see people being treated with. But the reality is that winter surge is going to be really be defined by who gets vaccinated now, as compared to last year, where it was really a matter of what's happening in our community and the fact that we were indoors at the time.
I like to ask my experts to kind of a humility test, and what's something about COVID-19 that we were completely wrong about. And I'll admit, I was maybe hopeful, but optimistic that we'd see cases go up in this third wave, but our vaccinations would be capturing enough of those high-risk individuals that we'd kind of come to a point where we wouldn't actually need to shut things down, and ICU beds wouldn't be in high enough need. But obviously the variants and the spread has thrown that. Anything that you've kind of looked back and thought we're way off on with COVID?
I mean, I think right at the beginning, the fact that this disease had pre-symptomatic transmission, that I was contagious before I developed symptoms, which is very different than SARS, where people were contagious around the time they developed symptoms, really changed the game. And if we had known that when this was emerging, I think we would have acted a lot differently in February and March. We would have probably readily promoted masking in public because we knew people were contagious beforehand. Probably travel restrictions would have been much more aggressive at that point. And I think we would have opened up testing to more of the general population rather than population-based. The other part, and I'm actually happy, but I was not that enthusiastic that a vaccine would be perfect. And I thought we would probably get to something like the influenza vaccine, where it works, it kind of works to dampen transmission. It's pretty good. It's not perfect. People break through. It might help them from getting sicker if they get it. But this wasn't going to be like the slam dunk thing that was going to, essentially turn off transmission. And, that I'm humble about, but actually happy about that I was completely wrong about that.
Yeah, as bad as our situation is now, I often think it was perfectly plausible that none of these vaccines, pan out in phase 3 RCTs, and imagine the situation we'd be in now if, our long-term care homes or retirement homes, if we didn't have that level of protection there. If we like, it's horrifying to think kind of what situation we'd be in. Back to vaccination. So obviously the CDC has put out some guidance about how what people can or can't do once they've had their full series. In Canada, we've obviously thrown a bit of a wrench into this, where the majority of people now are receiving one dose and then having to wait 4 months for their second. And I've gotten this question a lot from patients, and I've tried to give them a reasonable response. But what's your advice to people who ask, what can they do after their first dose that they're not doing right now?
Yeah, I mean, everything becomes a calculated risk at that point, right? And so we know the first dose of vaccine after about 2 weeks has effects. In some US studies, it's about 80% effective in preventing COVID-19. It gets better with time based on some UK data. We know there's a reduction in hospitalization, there's a reduction in death, but there are people that are hospitalized after their first dose. There are people that die after their first dose of COVID-19. And again, it's that calculated risk. How much do you want to expose to? I think for the individual now that gets a first dose of vaccine, doing things in a low risk manner becomes even lower risk. So, again, congregating with someone outside, using all the measures in place, distancing, masking when you're very close, and then adding the layer of having a first dose of vaccine really does help to say, okay, there is a lot of protections here that makes the risk of A, getting COVID-19 low, B, even if I do get COVID-19, the complication rate low, and C, the risk of death low in that context. I would not still say it is the best opportunity for higher risk individuals, particularly ones with chronic medical conditions that put them at high risk of hospitalization, to do an indoor gathering, as again, it's not perfect protection at that point. I wish we would have given people perfect protection, but again, from a community standpoint, it's a whole lot better to have a lot of people that won't end up in hospital die and dampen transmission, as compared to making a lot more people as good as it gets in terms of their level of protection.
What do you think the school year will look like in kind of the 2021-2022 school year? Like, do you think kids will still be masked? Because obviously we won't have vaccines for the majority of kids by then, right? We won't have any approval by then. What do you think that school year will look like?
I mean, I do think high school students may have access to the vaccine by the time they get in. We have the Pfizer data at least suggesting it's safe and effective. I'm not so sure about kids being masked, and again, some of our protocols being in place by September. The one thing I'll say is Israel, as they've been doing a mass vaccine campaign, they've actually interestingly seen COVID numbers falling amongst kids under the age of 18. They've vaccinated some of them experimentally, but they really haven't gotten to the rates of actually really vaccinating that population. And so I think that's really important. We can vaccinate the adults and help protect our kids, making school safer, and then using that as a buffer for the adults too, such that they don't get particularly ill if their kids get COVID-19 in the worst case scenario.
One more question for you, Dr. Chagla. So obviously we all hear kind of anecdotes from patients who are adamant that, they didn't see anybody outside their household and the only place they went was the grocery store, and how did they get COVID? Do you think that we're seeing spread in those kind of settings, or do you think that there's perhaps other interactions that they're having that they've forgotten, and whether that's kind of the main driver of these kind of mystery acquisitions of COVID?
Yeah, I mean, I think there's a mixture. I think there are things that people do that may slip out of their memory, and maybe that close interaction at a coffee shop, and maybe the mask's down for a couple of minutes, and maybe the adjusting the mask for a couple of minutes in that sense, in a higher risk setting. Can I say that people haven't gotten COVID-19 at a grocery store? No, it's happened. I mean, I think we've talked even grocery stores, we've talked about retail, we've talked about restaurants where customers have gotten COVID-19. I think, yeah, I mean, there is often in contact tracing, there's a usable other explanation for some of it. And with that being said, I think with what's going on now, it's still important people adhere to the precautions going to those settings. And again, try to minimize even the amount of time they spend in those settings. They should really be quick trips in and out to get things and minimize risk.
Thanks for joining us today, Dr. Chagla. We really appreciate your time, and it was a really interesting conversation, and hopefully our viewers took a lot out of this. So thanks again. So stay tuned after the break. We're going to take you on a tour of one of the new vaccination centers here in Vancouver. Welcome back. Our producer, Scott Navarro, recently took a tour of the North London Optimist Community Centre for their vaccination clinic to see what was happening there. So let's take a look.
Thanks for the opportunity to show you what a client experience will look like when they come here to N-Block. Thanks to the amazing partnership with the City of London, all the staff has been amazing throughout the process, working very closely with us to get the facilities ready, as well as to help support us as we move forward. When individuals come to our clinic, they will first be greeted with a security guard, who I would like to point out are very friendly in the process and play a critical role in making sure the process rolls smoothly. We'll start with screening. As you can see here, we have a couple screening desks set up. We have changed our process based on experience at other clinics, where we will now be providing screening sheets to individuals in their parking lot here, as well as our overflow parking lot down at Stronach. And that way they are able to read through the questions, and when they come through the door, the flow will be a little bit faster for them as they have already answered the questions. We will do an active screening and make sure they understood all the questions that we need to ask to keep the public safe and healthy. And then we will move them through this area with some of the staff members right onto our clinic area. The next process that clients will actually go through is a consent form. This is actually sent to them when they actually book their appointment, either through the phone line or they do it on the booking website, which can be found on our website at MLHG. The consent form is a really important process for our staff to understand that there are no contraindications for an individual to receive the vaccine. This is also something that we will hand out in our parking lots as well as down at Stronach so that they can be completed. But if you look down this hallway here, you will see we do have some seats set out. So if there is an individual who has not completed the consent form before they come inside, after they're screened, they have an opportunity to take a clipboard with the consent form and they can sit along here, and others who have completed their consent forms previously can move through this direction.
If someone has a problem like language or understanding what some of the questions in the consent form, would anybody be able to help them at that point?
Absolutely. We do have translation services that we offer. So we have an arrangement with an organization that we can call, and they can come and help an individual, as well as they can sit out on the floor with our vaccinators as well to ensure that we have the full consent process. So as you can see here, we have 10 desks set up in a row, all physically distanced so that individuals they have the space to walk behind each other, to stand at the desk safely. And this is where we actually make sure that they're ready for the vaccination into the system so that they're ready to go at that point. We can answer some questions for them at that stage before they move on to the clinic floor. One of the things that we realized we needed to improve upon was the flow at registration. There are a number of questions that have to be done. We have a couple different systems that the staff have to use. And so we have actually increased our number of registration clerks that will assist clients before they go on to the floor. So that's one of the major changes that we have made to increase to shorten, I should say, the amount of time that clients will actually spend in the facility. One of the things that we found really important is to continue examining our flow within the clinic and looking at practices that make it easier and safer for the clients coming through. So you'll see, for example, in this particular area, we have actually put a ramp through cooperation with the City of London, as well as hand railings, so that individuals have the ability to hold on if required. We realize with some of the individuals coming in, they may have some mobility challenges, so we try to make it as safe and comfortable for them. In this area over here, we have our pre-vaccination area. And this is where individuals, once they've gone through the registration process, they will be seated in order so that we are able to know who should be vaccinated next. And so they will sit in this particular area, and a staff member will actually call them over to a vaccination table when the next vaccinator is available. You will see in this facility that we have 22 vaccination stations, enabling us to reach up to 2,000 vaccinations a day once we have the supply of the vaccine for that piece. We do have a privacy booth as well that is available, so we want to make sure that we make it culturally safe, as well as someone who just feels like they need a little bit more privacy. we can have our vaccinator move down to our final station. There's drapes that we can close and make it completely private for them.
All right, thanks again to our guest, Dr. Zain Chagla, for joining us today and answering all of your questions. And thanks to you for joining us for another episode of Keeping London Healthy. We'll be back again next month for another episode, and hopefully by then we'll be out of lockdown. Take care.